as one of my colleagues said, I don't think the brains were braining. Welcome to another edition of dramatic readings of prior authorizations. You know, when someone has a hormone deficiency, such as hypothyroidism, we usually replace with whatever hormone is missing. If you don't make enough thyroid hormone, we give you thyroid hormone. If you don't make enough cortisol, we give you a corticosteroid. If you don't make growth hormone, we give you growth hormone. If you don't have enough parathyroid hormone, however, we usually treat people with calcium and vitamin D, because for a very long time we did not have a stable form of parathyroid hormone that we could give to patients. A few years ago, there was a drug called Natpara, but that unfortunately got recalled, not because of the drug, but because of the delivery system that it was in. Recently, a new form of parathyroid hormone was approved, and it is called Yorvipath. So, guess who tried to prescribe Yorvipath for a patient? That's right, it's me. So my patient has had hypoparathyroidism since she had surgery, I want to say 16 years ago, give or take. And even though her calcium levels are okay, taking high doses of calcium, she's taking 3,000 milligrams a day, and an active form of vitamin D, and her calcium level is all right, she still gets muscle cramps, tingling in her fingers and her toes. The muscle cramps wake her up every night. She felt better when she was on Natpara, but then it got recalled. So she hasn't been on it for the last couple of years. And since stopping it, again, her muscle cramps are back. She gets numbness, tingling in her hands and her feet. So I prescribed Yorvipath, and not surprisingly, it needed prior authorization. And it got denied. And here's what they said. We denied coverage for this drug because this drug is not on the formulary. We are denying your request because we do not show that you have tried at least 2 covered drugs that can treat your condition. You have already tried this formulary alternative, calcitriol, 0.5 microgram capsule. That is the active form of vitamin D that she's currently taking. Other covered drugs is our calcitriol intravenous solution, 1 microgram per ml. Now, first of all, intravenous calcitriol is not approved for the use, it's not indicated for the treatment of hypoparathyroidism. It is meant to be used in people who have chronic kidney disease and are on dialysis and have what is called secondary hyperparathyroidism. So they want my patient to use a drug that is not indicated for her disorder. And not only that, how is she going to get IV calcitriol? Are they expecting her to self-inject into a vein? I mean, it's not like insulin where you just give it under the skin. Or are they going to be sending a nurse 3 days a week to find an IV and put this in her? This is so ridiculously stupid. I